Hello, this is Janae Hodge. Today I'm going to demonstrate how to tube feed a puppy. A lot of people may be intimidated by it. It is somewhat challenging to do, but anyway, this will be my third separate time tube feeding puppies in the past going on 8 years of breeding. I had a litter recently with some cleft puppies. This particular little puppy, he's got a double cleft lip, so it makes it more challenging for him to get a good latch on his mom. So I want to make sure that he is getting enough nutrition and enough milk so that he can survive. I make my own puppy formula, and later on I'll put up my recipe to do that. But basically, you should be feeding them 1 cc of milk per 1 ounce of body weight, and this little guy is right at about 15 ounces. So I pre-warmed up a bit of milk in a warm glass of water in a bottle, and here I have a 30 cc syringe that I have the milk in, and basically, I have 2 different sizes of the catheter tubing. One of them, I think it's a 5 cc size, and the other one, I'm not sure. Some of the puppies do better with a bit larger of the tubing, and some don't. So you just have to kind of experiment and see what works better for you. Today, I'm going to use the larger size of tubing, and he seems to do pretty good with that. So here is my little guy here, and in order to make sure that I'm getting that tubing in his stomach where it's supposed to be, I'm going to find his rib cage and measure up to his mouth to make sure. So I have the end of the tubing right at the edge of his rib cage, and his mouth is up here, and I marked it with a piece of tape so I know it's going to be getting into his lungs, or excuse me, into his stomach and not his lungs. So it's important to measure that correctly. I'm going to put my tubing on the end of my syringe, and then I'm going to push any air out that might be in there, because I don't want to be putting air in his stomach. So I just make sure that the milk is dripping out. Now sometimes your little puppies can move around quite a bit, and it's more difficult to get the tubing in their stomach, and what I do is swaddle them like a little baby. So I'm going to wrap this towel tight around his arms so that he can't keep pulling away from me and pushing the tubing out of place. So I'm gonna open the edge of his mouth with my finger and get the tube in his mouth, if he'll let go of my finger. So I've got the tubing in there. He's kind of pushed through my towel here. Sometimes it takes a few attempts to get it in there right. I'm gonna kind of try to show this a little bit more. He does gag a little bit. They do gag a little bit sometimes, and he's actually got a grip on it with his mouth right now. So he's trying to fight with me a bit, but I'm gonna ease it in there a little bit at a time. Okay, yeah, he's fighting a little bit. Okay, I've got the tube all the way to that piece of tape, and what I'm going to do is hold it between my 2 fingers right here at the side of his mouth. So I've got it there. I'm going to hold it securely, because sometimes they can push it and get it out of place. So what I'm going to do is just slowly press the syringe here, and I'm going to listen to him to make sure that he's not coughing any of that milk up, or it's not in his lungs. They do fight a little bit like this. This is pretty normal. So I'm going to start putting it in a little bit at a time. You don't want to do it so fast that that it bubbles back up their esophagus. Again, I'm giving him about 15 cc's of milk, because he's about 15 ounces right now. So some of these guys can't hold enough of that fluid at one time. So I'm going to put it back in there. He's really fighting. It's better if you have one that regurgitates milk out a lot to do less milk at a time, but more frequently. That way it's not going to come out as bad, and sometimes it's a bit easier on them. So this little stinker, he really wants to fight me. This is pretty normal though. We have to do this sometimes, several times to get it right, so that's all right. You have to be patient and you can't force it too fast. A lot of them will gag quite a bit when you're putting the tubing in too, so he's got a good grip on this with his mouth, so I'm going to try to move it to the side of his mouth here and so I can hold it securely. Alright, I got most of this milk in there. He's kind of gagging a little bit. That's pretty normal. I always have on hand also a nose syringe, a bulb syringe. So in case they regurgitate and it comes out their mouth, I have something I can clean them up with. So he seems to be pretty fine, but sometimes the milk will come out their nose and you just want to have an extra towel or something there to wipe the milk out, and then also a bulb syringe in place in case they need their nose suctioned out a bit. So that happens sometimes. If you do have one that does that quite a bit, I recommend maybe feeding them smaller portions at a time, just more frequently, so that milk will stay in their stomach and it will be a bit easier on them. So this guy seems to be doing pretty good. He's pretty happy now that he got his tummy full. After I feed them, sometimes I let him suck on my finger. It helps any more milk just kind of settle in their tummy. Oftentimes before you feed them, it's good if you get a cotton ball and get it wet with some warm water and let them go to the bathroom, let them urinate, and let them go number 2 if they need to, so you can empty out that bladder before you start feeding, and then make sure after you feed them then you are doing the same thing, you know, making sure they've gone to the bathroom and they're doing well. So anyway, hope you guys learned something. Let me know if anybody has any questions. I'd be happy to answer any questions anybody might have. Thank you. Bye-bye.